This patient was referred to me for examination and endodontic retreatment of tooth number 14. According to the patient, the root canal was done more than 5 years ago. The crown is about 5 years old. Recently, patient started to have pain associated with the tooth, and then she notices swelling. All right, so take a look here. Porcelain crown here. It looks like amalgam buildup. Huge prefab metal post. Previous root canal, of course. Look at that huge periapical lucency. It looks like the lucency is only associated with the mesial root. You can see distal buccal and palatal are clean. Let me show you a different angulation. And here it is. Again, you can see a huge periapical lucency here. Distal buccal and palatal roots are clean. All right. So do I need a CBCT? Percussion, tender palpation, tender. I'll show you the clinical presentation of the tooth. Probings 2 to 3 millimeters all around. Again, you can see a huge periapical lucency here. And take a look here. Okay, that's the clinical presentation of the tooth. That's the tooth here, porcelain crown, and you can see a buccal parielis and sinus tract associated with the tooth. That's the tooth right here. All right. So, do I need a CBCT to know what's wrong, what's going on with this tooth? Do I really need to get a CBCT to see that there's a missed mb2 here? Take a look, right there. I don't need a CBCT. It's just 2 x-rays and boom, it's done. So there's a missed mb2 here. And again, you can see that large periapical lucency. So we discuss options with the patient. Patient wanted to try to see if tooth could be saved, and that's what we did today. Went through the porcelain crown. I decided to leave the palatal root alone. I got in there and didn't see anything out of the ordinary. Of course, the problem was the missed mb2 there. So no foul smell, no discoloration or anything like that. I checked everything. Removed the gutta percha from the mb1 and troughed for mb2, and lo and behold, take a look. Right there. And again, you can see that large periapical lucency there. So missed mb2 was the problem. And as you can see here, mb1 and mb2 join. But it doesn't matter. It doesn't matter because even though mb1 was located and obturated, mb2 wasn't located, disinfected, and obturated. So this dentist left necrotic tissue and bacteria behind. And again, it doesn't matter that mb2 joins mb1. When you leave necrotic tissue and bacteria behind, all the bacterial byproducts will leak. It doesn't matter if they join and mb1 has created an apical seal. Apical seal breaks. Even if you leave necrotic, even if you leave bacteria behind in the canal, and then do an apical and retrofill with MTA instead of a non-surgical retreatment first, as I always recommend if there is a way to do it. Even MTA leaks. So as you can see here, mb1 was located and instrumented and obturated, but mb2 wasn't, and bacteria and their byproducts broke that apical seal over time and caused an abscess and infection. So even I mean, I have some dentists who say most cases mb2 joins mb1 anyways. Why do we need to why do we need to instrument and you know, irrigate and all that stuff, disinfect mb2 when mb2 joins mb1? Well, here it is. This is an example of it. All right, so mb2 right there. All right, everything went great. We went ahead and temporized the tooth and referred the patient back to her dentist for the permanent restoration. All right.